Thank you. Thank you, guys. Obesity, as you know, is one of the most important cardiovascular modifiable risk factors. If you are obese and your BMI is over 28, you have a higher risk of having cardiovascular disease. So there are now a lot of newer medications which have come out in the market. You must have heard the ads on Ozempic and Mounjaro. So that's a class of drugs called GLP-1 agonist. And these medications actually are very helpful in weight loss. You can reduce up to 40% of your body weight, and they are very safe from cardiac health standpoint. The main issue with using these drugs is the side effects. There is a lot of nausea, there is a lot of GI discomfort. And more importantly, if you are using these injections, then you have to also change your lifestyle. Because if you don't stop eating, these medications are not going to help you. So if you stop, then your weight will come back. So it's very important to modify your lifestyle. These drugs are safe from cardiac health standpoint, and actually we do recommend use of these medications to our patients. Thank you.
Thank you. Okay. Sanmitra, are you Dr. Sanmitra? So, can you speak to us for a quick minute on what is chronic kidney disease? Here.
Hi, good morning. My name is Sanmitra Sahu. I'm a nephrologist. And the question is, what is chronic kidney disease? We define kidney disease usually with a form of creatinine, and that usually means that the kidney function is reduced. We are particularly concerned when that number is less than 60. So you can think of it as less than 60% of normal. And the most common reasons for chronic kidney disease worldwide are high blood pressure and diabetes. So control those risk factors, and that's the best way to keep your kidney disease well controlled or prevent it from developing. And see a nephrologist if your doctor recommends it. Thank you.
Before she leaves, let's ask her a question. How much salt is okay for Indians to eat?
South Asians, including Indians, are very susceptible to cardiovascular disease in general, including chronic kidney disease. So low salt is very beneficial even if you do not have frank high blood pressure. A general number is about 2 to 3 grams a day, and I think the way we eat, we can actually stay well within that limit if you're mostly eating at home. Yes, you're really eating something different from usual.
बेसिकली आप ऊपर से नमक मत डालिए, जितना डला हुआ है घर में उतना काफी है. Don't ask for more. अचार है पिकल.
That's the thing.
Don't eat achar.
That's blasphemous, so I'm not going to say that. All things in moderation. So, yeah, put lots of fruits and veggies in your meals, less carbs.
Stay healthy, stay happy. Can I have everyone's attention? Thank you for keeping silence. Next, I'm gonna invite Dr. Rikin Shah and ask him to talk for a minute. This is gonna be a challenge. Let me ask a question. What is bone marrow transplant, and how can you be a bone marrow donor?
Yeah, hi everyone. So bone marrow transplant is a complex procedure where we can treat high-risk leukemias, lymphomas, as well as some non-malignant diseases. Basically, any diseases which affects our blood cells can be treated with bone marrow transplant. Wherever what transplant comes, it's essentially taking an an organ from an individual and transferring to another individual. In this particular transplant, we are transplanting blood which originates from bone marrow. So bone marrow is the factory of our blood cells, which is essentially every bone of our body, which we can collect from either the hip bone or from the blood. So it's a very noble thing. One thing I'd like to tell everyone is to be part of the bone marrow transplant or bone marrow donor registry. The registry is called NMDP, National Marrow Donor Program. This registry is consisted of around 35 million people around North America and Europe. Very little representation from people from Southeast Asia and Indian origin. So if an Indian origin person needs bone marrow transplant and do not have a sibling or a related donor, then finding an unrelated donor on the registry is very hard because the representation from our community is less. So I urge everybody to be, if not already, to be part of the registry. It's a very simple thing to do. Just go online, bethematch.org and just sign up to be a donor. They will send you a swab at home. You just swab on your cheek, send it back to them, and then you stay on the registry. This is a very simple thing to do, and a procedure like this can save somebody's life in a real sense. So I really urge everybody to be part of it. To be a donor is extremely safe. If you ever gotten chose to be a donor, it's a very safe procedure and does not harm the donors. So it really can save somebody's life. So please keep trying to be on the registry. Bethematch.org. If you need any more information, we'll be here. I'm here. Please ask me anything. Thank you.
Thank you so much. Guys, please a request from the panel from this side. We are having a very important discussion. We don't get these kind of sessions every day. Please be a little bit, keep the silence over there. Now, this bone marrow transplant which we talked, I am an oncologist too. जब कभी हमारे अपनों को जरूरत पड़ती है, इंडियंस के पास बहुत कम ट्रांसप्लांट वाले डोनर्स मिलते हैं, just because we do not have that much awareness. Please take your time, go to him and ask him about how you can be donor. You never know. You will be helping someone in need. And it is not a difficult procedure. Thank you everyone.
Question. Does somebody have a question? Rikin, the question is there an age limit to be a bone marrow donor?
Sorry. To be on the registry is 40, but if you have a related person, so if daughter or son, we would take stem cells from any age. Ideally younger is better, so that's why the registry people is 40. But once you are on the registry, you can be there, and many doctors would use 45, 50-year-old donors as well.
Is there an upper limit?
So as I said, whenever we choose the donors, the primary thing is to donor safety. So as we grow older, we accrue other diseases, as others have said, right? Diabetes, hypertension, hypercholesterolemia. So then the safety of the donor can get challenged if they are chosen as a donor. So we would not like to take risk at that. And that's another important aspect. Whenever anyone gets chosen to be a donor, they get through a very rigorous evaluation by a transplant physician before they are chosen to be a donor. So if somebody is on the registry and they find to be matched with an unrelated person across the globe, right? So you still will go through the rigorous evaluation and be confirmed that you are safe to donate. And age is really basically means all of this. So but if a related person has a disease, we would still try to use the younger donors. This is a very good question. It's an extremely important thing that when you are a donor, It does not affect you or your financial responsibility at all. All the cost of donor acquisition, getting cells from donor is billed to the recipient insurance. So recipient insurance gets charged with all of that. Donor or donor's family is not responsible for any money. Thank you for all the questions.
And Dr. Shah is coming here for the next foreseeable hour or so. So please ask him some more questions. Of course, thank you so much. Next, Dr. Vikram from Neurology. I would like you to talk and tell us about what the most common symptoms of Parkinson's disease. When should you consult the neurologist?
Good morning, everybody. So, with regards to Parkinson's, I guess the most common identifiable symptom that you might see is tremor. So, the difference is, as opposed to having a tremor when, say, you're eating, drinking, trying to do things with your hand, the tremor in Parkinson's tends to be more what we call as a resting tremor. So, when you're not doing anything, you're just sitting, you're watching TV or something, and your hand is constantly shaking. So, that's a Parkinsonian tremor. In addition to the tremor, you can also have trouble with slowness and loss of dexterity. So maybe you have trouble buttoning your clothes, or you have trouble cutting food, or your handwriting becomes very small. And then eventually Parkinson also affects your walking, so you get slower, you have trouble with your balance as well. And in the advanced stages, Parkinson's can also affect memory. So especially if you're having tremor, especially when you're not doing anything, if you're at rest, then it's a good idea to go and see a neurologist and get a diagnosis whether it's a Parkinsonian tremor or whether it is something else that can also cause tremors as well. Because the sooner you diagnose Parkinson's and start treatment, the longer you're likely to live without any disability. So if you delay any diagnosis of Parkinson's, that increases the chances of sooner disability as well. On average, it's not that patients might go 4 to 5 years without being diagnosed to have Parkinson's. So if you're having any such symptoms such as tremor, slowness, loss of dexterity, trouble walking, etc., it's a good idea to get it diagnosed sooner rather than later. Thank you.
Any questions for him? He's here. You guys can go over and ask him more questions. But any
Every tremor needs little attention. There is a reason behind it. It might be just something benign. Please do not ignore. We have people who can help you.
Thank you so much, Dr. Vikram. Next, I would like to invite our ex-president, Dr. Sethi, to talk about a very difficult topic, but to talk about depression and what's the percentage of the suicide rate.
Thank you. Well, let me introduce. My name is Dr. Hanish Sethi. I'm practicing psychiatry over 28 years now. It's my privilege and thank you to Papi and honorable guests who are present here. She told me to talk about depression, which is on the peak, dear people. Depression, anxiety, we are on the peak of this over the last 4 years. And not to disregard the suicidality rate in our teenagers, adolescent populations. I have seen the peak during the COVID. Early sign has to be recognized by our family members. These are the first people who see what's going on with our friends or family or our child or our parents. Please do not neglect that early sign. Whenever I see the very late stage of the suffering, and we don't want that happen to any of my family or my friends or my community. Please, if you have any question, I'll be available to answer individually as well. Thank you again.
Thank you so much. This is such a difficult topic and there's so much to learn. Just know that there are experts in the community that you can reach out to. There's a question.
Talking about that most of your patients you find it later stages. What are the symptoms or early symptoms?
Great question.
Very, very good question.
The early sign which we recognize in our family member, friends or community whenever we meet them is very people tend to isolate. They become more and more reserved to themselves. They stop communication. they stop their routine activities. So somebody see a change in their appetite, change in the sleep pattern, or their communication when they don't talk, they give up their socialized activities. That is the early sign. And then please ask them what is going on, because they are waiting for you to ask. You don't ask, you will not get the answer from them. This is my personal experience. People do not talk about mental illness, do not talk about their suffering whenever they have suicidality. Please ask them. You don't ask, you don't get it. Thank you, that's a very good question. And same with the adult population, our elderly parents, they don't talk about that type of illness very commonly either. If you see any change in their pattern of sleep, activity, eating, communication, those are early signs. Thank you.
Okay, thank you so much for your attention. I'm going to ask for silence and respect, please. Thank you. Next, I'm going to invite Dr. Pankaj Bansal to talk very briefly about diet in arthritis.
Guys, please, we really request, people are not able to hear. Everybody has taken their time out. If kids want to play, they're most welcome to play outside. But please respect everybody's time.
Hi, I'm Dr. Bansal, I'm a rheumatologist. So this is a very common question that we get, what kind of diet can I eat to help my arthritis? So the first thing I say is there are 100 different types of arthritis. So no one diet will be the same for each different type of arthritis. There are several studies that have been done that are ongoing, and none of them have shown any direct benefit of diet for joint pain. Having said that, now almost every type of arthritis is associated with heart attacks and strokes and more adverse cardiovascular or bad outcomes. So what we say is, follow the diet that your cardiologist advises. Low salt, low carb. There are a lot of anti-inflammatory and Mediterranean diets that people invest into, which is fine. But I say, don't put a lot of money into it. It's not going to help you any more than eating a healthy regular diet.
As a young adult, doctor, are there any preventative measures we can do to kind of minimize pain, joint pain?
That's a good question. Again, as I said, the question was as a young adult, what can we do to prevent arthritis? So the most common type of arthritis that affects us is osteoarthritis, which is wear and tear of the joints. It is going to happen to everyone eventually. What we can do to prevent it is stay fit, stay healthy, exercise your joints. Everyone should exercise. There are different types of exercises which you can, do it on your own. You can go to a gym, you can have a personal trainer. Exercise is the most important thing to sort of delay the onset of arthritis. And the second most important thing is avoiding obesity. If you're overweight, you need to lose weight. Besides that, there are not a lot of preventive things that can be done. So diet and exercise.
So much. Thank you, Dr. Bansal. Thank you. Next, I'd like to invite Dr. Shachi to talk to us about the right brushing technique and should we use electric brushes.
Hello all. So whenever it comes to brushing, the right technique is the most important. Brushing on the side of the teeth, chewing surface, and the inside surface of the tooth. Plus, you have to make sure you brush right at the gum line as well. If you just brush on the top, it's not going to help you much. You will keep developing gum diseases like periodontitis, gingivitis, and all. And when it comes to the electric toothbrushes, they do help with brushing better in a way. The bristles brush as well as you move your hand too. So it does have advantages, and American Dental Association do recommend using electric toothbrushes like Oral-B, Sonicare, and all that. Thank you.
Okay, so how many of us are using electric toothbrush? Okay, Dr. Bhatta, can you please come up here? Do you think that's the right answer? Because somewhere I heard it's okay to use the regular brush because with electric brush, you are removing whatever.
Okay. The most important thing, like many people will say, how do I keep my teeth for a lifetime? And everything is revolved around 80% of the treatment you do, like prevention, good effective brushing, all that is going to help you keep your teeth for a long time. If you basically neglectful, like most of the Indian population, they don't floss, and you get cavities between the teeth. So how do you, electric toothbrushes will help the outside surfaces, but it will not clean the in between the teeth. So flossing should be another essential part of your regimen. So prevention, remember one thing, prevention starts early in life. If you cannot just wake up when you're 60 years old and say, listen, I'll start flossing now, I'll start brushing now. You have to start flossing and brushing at the age minimum 14, 15 years old, so that you can maintain a regimen of keeping your mouth clean for a lifetime. So if you invest in flossing and brushing, what you're basically doing is you are keeping the bacteria and the food particles away from the teeth. Remember, any food, any basically bacteria which you leave it in your mouth, you don't brush, you basically will be encouraging acid formation. Acid formation will demineralize the teeth, and they will, that is what is called a cavity. So the goal is of effective brushing, effective flossing, is that you keep the bacteria and prevent the formation of acids there. So 80%, or if you can do all this, you probably won't have to see the dentist for any major dental work at all. Any questions?
There are so many kind of floss available. Which one you consider is the best way to floss? And another thing, people who have arthritis and they cannot handle the thread thing, how would they floss?
Okay, the question is, what type of floss should we use? There are basically two types of floss available. One is the wax floss and one is the non-wax floss. Just as common sense would say, by using non-wax floss, you will remove more plaque. Wax floss is more for people who have a difficult time making the floss go through the teeth or between the teeth. So if your teeth are very tight, then use the wax floss. If you can easily take the floss easily in your mouth, non-wax floss is more effective.
How many times you can do brush, like morning and night, or both freshener is good enough in the night?
So the question is, how many times do you floss and brush? Any common sense answer would be, like I said previously, keep the bacteria and the food away from the teeth. So the most effective way to do things would be floss after every meal, brush after every meal. But it's not practical. So you must remember one thing, that if bacteria are not cleaned within 24 hours, they will start sticking to the teeth. So minimum once is mandatory, twice is better, flossing and brushing after every meal is still better. So just remember, don't allow food to accumulate on the teeth, which will lead to formation of what you call plaque. Anything else?
You know, we have this toothpaste, Dant Dant.
Is that better than Colgate and other toothpastes that you get here?
Okay, the question is about toothpaste. Which toothpaste to use? Now, the best toothpaste is the toothpaste that has the minimum particle size. Colgate fits into that category. Now, you have toothpaste basically like Ayurvedic toothpaste and others. Well, I have nothing against them, but if they work for you, some of them are good, you can use it. But I think more than anything else is that the technique of brushing, that is the most important thing. Toothpaste is more like a mouth freshener. Now, if you people have the whitening toothpaste have a bigger particle size. So if you can stay away from that, that's still better.
So next I'm going to invite Dr. Rajan Kalia to talk about one of the most common issues that we all face, how to manage back pain. And I know there will be lots of questions and he's going to be available so you can ask them. Next, I please request everybody to maintain silence, especially the kids. Moms, please watch your kids.
Sorry, moms. Please, kids, please be silent. It's not going to be too long, okay? And audience, please, you can write your questions. We will entertain them in few minutes after we are done with this program.
Hello, good morning, everyone. My name is Rajan Kali. I'm practicing interventional pain management. So, when it comes to back pain, very common. So initially, you usually see a primary care doctor and try what's called conservative things like, take some medications, and probably the next thing that comes is physical therapy. So I come in between those things, like for example, medications, physical therapy, and then on the higher end, if things are really bad, then you need a spine surgery consult to see if surgery is going to help you. So I come in between where I do all these minimally invasive interventions, like things like epidural injections, facet injections, ablations, and like there are newer procedures for things like spinal stenosis that affects a lot of the older population. But that's kind of the realm that I come in. So I do have actually a little bit another thing I have to add. Like I think there was a little bit of talk about arthritis, prevention of arthritis. So I'm a strong believer, and I think some good things were mentioned. Definitely activity is a positive factor. Like a simple thing like if you incorporate walking, it's going to positively affect your knees and your back and everything. And also, I'm a strong believer in an anti-inflammatory diet. If you have any questions, you can ask me. Anti-inflammatory diet will help you your many kind of pains, and I personally follow that. So I'm a strong believer in that. But I can take whoever has questions.
You mentioned anti-inflammatory diet. Can you please elaborate?
So basically, just go on Google and put in anti-inflammatory diet. What's going to come up? A lot of fruits and vegetables, which I mean, usually Indian diet we do follow fruits and vegetables, but I'm trying to take a higher amount of some fruits like blueberries and things like that. They are very high antioxidant content. And I personally say, everybody has these aches and pains, and if you actually do that, you will see an effect. You will see an effect. But a lot of people don't listen to it. Even my own family members don't take my advice. They like to take the Motrin and things like that. So that's, it's easy to look up. Go look what are the fruits and vegetables that have the highest content of antioxidants, and that's your best way of getting some in your body.
Guys, you all are getting these raffle tickets. There is a reason for that. जो ये सब आपको पढ़ा रहे हैं, इसके आंसर्स आप दोगे, then only you'll win a prize. So please focus. Thank you, Rajan. Anybody has any questions for Dr. Kalia? He will be here on the panel. Please feel free to ask. Now we will have our endocrinologist. I will ask her one question, that is Dr. Rema Gupta. What is the best advice she will give from endocrinologist perspective? Dr. Gupta? One advice you will.
All right. Can I have a show of hands who has a family member or themselves has diabetes? All right, let me say that again, because statistically it has to be more people. Who has a family member or knows someone or themselves has diabetes? Okay, that's what I thought. So I was asked to give one piece of advice from an endocrinologist. So I'm going to give you three. First one is, if you have to start insulin, it may not be forever, and it's okay. And we're here to help with it. And there's many different ways to give insulin. Second piece of advice is, every 3 months, please try to go and get some lab work done. And lab work would be kidney function, hemoglobin A1C, and you don't even have to go to your physician to get the lab work done. There's many places that will do it for $50. There's a place called, and this is no endorsement, I use this myself. There's a place called Any Lab Test Now that has locations in Winter Park and Ocoee, and you get online, you pick your labs, you pay $50, you go get them done. So please try to get your blood work done every 3 months. And then the third piece of advice I'll leave you with is, nothing in diabetes management is permanent. Your medication you're put on will always change and always fluctuate, and that's okay. So you may be started on one of the medications that you may have heard of called Ozempic or Jardiance or Metformin. But then 6 months later, it'll change. That's normal. That's the way your diabetes management should be. You should be worried if your physician doesn't change or address your management every 6 months, because diabetes management is always fluid. It doesn't stay the same. So thank you for coming, and thank you for the organizers, and good luck with everything.
For any questions, please see the expert on the table. Now I would like to invite Dr. Nilima, our president-elect for CAPI this year, to give us to talk to us for a minute on women and heart disease.
Thank you, Shweta, for introducing. I'm Nilima Katkuri. I'm an interventional cardiologist at Orlando VA. I'm going to be the president-elect for this year. My favorite topic is anything which is prevention, heart attack prevention. My grandmom died of heart attack, so that's the main reason for me to be an interventional cardiologist, and I feel so immense pleasure whenever I save a patient with a heart attack. I would like to see if you guys have any questions regarding women in heart disease or any topic related to cardiology. I'm happy to answer. Any questions? One thing I want to mention is, please don't ignore women doesn't have a heart attack. That's not true. Women do have heart attack, and that's the main reason. We ignore saying that it's just acid reflux, it's just acid reflux. So even simple acid reflux, you cannot say it's acid reflux until you make sure your heart is good. So once your heart is not having any problem, like do appropriate testing, make sure women in particular, they have different symptoms compared to men. It's not always like, oh, it's not going to the left arm, it's on the left side, it's not that. So please don't ignore. Sometimes heart attack can happen and you will have neck pain too. So neck pain is also an important thing which can cause coming from heart attack. So please don't ignore those especially women. They are presented very atypically. Even you may have just arm ache. So just make sure it's not the heart, and then you can say, hey, it's not my heart, so it's just the arm, or it's just. So it should be other way around instead of saying it's not coming from heart. You make sure your heart is good, then you can say it's not coming from heart. Okay?
Guys, please, I cannot announce again and again. Kids, you guys, not only kids, adults also, please have some, little time here. We don't have that much time. We'll be done soon. Just 5 or 10 minutes of silence. We have such good topics being covered here.
Okay. I have first question over there, and then I'll give it to you. Oh, okay. Yeah.
Can you talk about symptoms of heart attack?
Symptoms of heart attack. How can you identify it's a symptom? It's very hard to identify symptom of heart attack. That's what I'm saying. It's atypical. It can be on the left side of the heart. It can go to the arm. It can go to the neck. And sometimes it can be only in the neck. But it's most likely after exertion, which means you walk a little bit and then you started having pain. Or you do gardening and then you start having pain or difficulty in breathing. It cannot be all the time it's a pain. It can be new onset of difficulty in breathing. For example, you are able to do 10 minutes of walking every day, and today you develop and difficulty in breathing. That could be a heart attack too. It cannot be always pain. And when you have diabetes, you can present very atypically too.
Can you talk about the duration of the pain?
Duration of the pain. Duration of the pain, it's not just less than 1 minute. Usually more than 1 minute. It's associated. Classic symptoms are different from when you have, like Google says, I know all of you Google whenever you have some kind of symptoms. So Google says, oh, you should be having sweating associated with, difficulty in breathing, your heart is racing, all of that. Not all the time it's the same. You don't, one shoe doesn't fit all. That's a very,
How do you differentiate between esophageal, severe esophageal spasms and the heart attack?
How do you differentiate? That's a very good question. How do you differentiate between esophageal spasm and heart attack? That's hard to differentiate. You have to make sure your heart is right before you say it is esophageal spasm by doing a stress test and an echocardiogram. Then you can say it's a spasm if nothing else is found on the heart. But it is hard to differentiate, and you cannot ignore. Please do not ignore heart attack symptoms. Yeah.
That is Dr. Neelima. She is our president-elect next year, KABI president. She will be here till the end of the program. Please feel free to ask her any questions. Now, a brief thing. We are having our last speaker right now. We'll have a little break for 10-15 minutes. You can please go and ask any questions to the panel. And please, Sony Medical Group, who are our platinum sponsor here, they have set up the booth there for blood pressure IQ checks. Please visit them. And after that, in 15 minutes, we will be starting the Republic Day program with flag hosting. That program will be followed by very, very important 5-minute talks, which I think everybody should listen to those. Then we will also have CPR training by our cardiologists in town, followed by raffle tickets. So anybody who stays till the end will be eligible for those, and there will be lunch after that. Okay, now Dr. Mrunal Patel, she's going to talk about lifestyle medicine.
Hello everyone. So how many of you suffer from chronic conditions, blood pressure, diabetes, cholesterol? There you go. How many times have we heard this broken record? Lifestyle changes, right? It's like I tell you to fly a plane and I give you a manual, go fly it. It doesn't happen like that. everybody needs somebody to teach them how to make those lifestyle changes. Yes or no? Right. This is exactly what we do in our practice. If you have questions, please come and find me at the booth. It is the number one thing we need to do to reverse a chronic condition, to make changes, is first identify your underlying cause. Then you start working on it, and then you teach people how to put these lifestyle changes so we don't end up on being on medications for the rest of our lives. Okay? So please find me at the booth. It is doable. The change has to come from you, not me. So find me at the booth, and definitely we can make something happen for you. So I'm very fortunate to be doing this, and I would love to have each and every one of you. Everybody has almost lost their patience now. People are going to have their program. So please find me there at the family medicine booth, and we're happy to answer any of your questions. Thank you.
Now for 10 minutes, we're going to meet here again and we're going to continue our program. We'll start with the flag hoisting. So it's 11:23, so we'll start at 11:30. Okay?
So everybody, you can now ask questions to our panel there. They will be leaving soon. So if you have any questions, feel free to ask. We will start in 10 minutes again.
Kids, please stay inside. Please don't go. You guys have to stay here until we do our program, okay? All the kids, stay inside. Do not go outside to play. अगर किसी को रैफल टिकट नहीं मिली है तो प्लीज लेट मी नो आई हैव इट ओके हु एल्स
Mr. Ramesh, can you come here please? Mr. Ramesh. Mr. Ramesh, can you hear me?
Okay, can we have everyone's attention, please? Thank you so much. Now the most important part of the program, celebrating our Republic Day. Can we all settle down and can we have everyone's attention? All the kids. We have some beautiful performances.
Hello, hello, hello. Please, please pay attention here. Hello. Jai Hind. Jai Hind. Please maintain silence here so that we can start our presentation. Guys, please pay attention. Please bring silence here. Jai Shri Ram.
Everyone settle down. On the expert side, everybody settle down. Let's just have everybody's attention before we can start our flag hoisting ceremony. Thank you everybody for your attention. I'm going to start calling some names now. Dr. Shachi, Dr. Pandey, can we have your attention? I want to have everyone's attention with all respect before we can start our flag hoisting ceremony. From here, Pratika and Ashish are going to take over. Pratika, if you want to introduce the flag hoisting ceremony, then go from here. Hello everyone, Jai Hind! I would like to invite Dugalji, Anita Dugalji and sir. Dugal sir, please come on the stage for the flag hosting, followed by Neelam's beautiful songs and national anthem.
जनगण मन अधिनायक जय है भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाए तब जय गाथा जन गण मंगल दायक जय है भारत भाग्य विधाता जय हे जय हे जय 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 जय
Everyone, we are going to sing US National Anthem. Can I please ask everyone to stand up, please? Thank you.
They moved to the night that our land was still there. Say, who's the star-spangled banner yet wave o'er the land of the free and the home of the brave.
हिंदुस्ता हमारा हमारा सारे जहां से अच्छा,
सारे जहां से अच्छा हिंदुस्ता हमारा हमारा सारे जहां से अच्छा। हम बुलबुले हैं इसकी ये गुलसिता हमारा हमारा सारे जहां से अच्छा। हिंदुस्ता हमारा हमारा सारे जहां से अच्छा। गोदी में खेलती है जिसकी हजारों नदियाँ, गोदी में खेलती है जिसकी हजारों नदियाँ, गुलशन है जिसके दम से रश के जहां हमारा हमारा सारे जहां से अच्छा। हिंदुस्ता हमारा हमारा सारे जहां से अच्छा। मजहब नहीं सिखाता आपस में बैर रखना, मजहब नहीं सिखाता आपस में बैर रखना। हिंदी है हम, हिंदी है हम, वतन है हिंदुस्ता हमारा हमारा सारे जहां से अच्छा। हिंदुस्ता हमारा हमारा सारे जहां से अच्छा।
बोलो भारत माता की। Thank you. Jai Shri Ram.
Thank you, Neelam. Thank you so much. Thank you, kids. It was so amazing.
Watch your steps. Watch your
Jai Hind. Jai Shri Ram. Yeah, what a proud moment, celebrating 75th Republic Day of India here in Orlando in our temple. What a proud moment. It's so nice. I would like to express my gratitude to Duggal ji, Anita ji, Ashu ji and Kapi. And our sponsors here, Sony Practice and Sood Family and our own Shweta Gupta to make this happen here. it is a very special day. It is a very, very special day. And you know, it is a very special day as I see our founders of Sanatan Dharma program, Kritika Jain here. I would like to take this opportunity to go and talk to her. Hello Kritika ji. We are glad to see your presence with your Sanatan Dharma education program kids here. Please tell us what you guys are doing today.
Thank you, Ashish. Hello, everyone. Jai Hind! So we are going to present some pictures from the Constitution of India, and it's going to show relationship with our Indian heritage, culture, and our religion. So we're going to start it right now.
Glad to hear that. Then let's not wait. Let's start. Oh, I think it starts with a question to everyone. Who won the Ram Mandir Ayodhya case? Babri Masjid Waqf Board, Nirmohi Akhada, Ram Leela Varjman, and Ram Mandir Trust. So who thinks it is 4? Raise your hand please. Okay, who thinks it is 3? Ram Lala Varjman. So we will tell you the answer. You guys can search it. We will tell you the answer after our presentation. Okay, let's start with it. I will call our first kid here, Ishan. Please come over. Have a big applause for him, please, guys.
The Constitution of India is the supreme law of India. It is the longest written national constitution in the world. It was adopted by the Constituent Assembly of India on 26 November 1949 and became effective on 26 January 1950. This drafting committee was headed by B.R. Ambedkar.
Good job, Ishan. Thank you so much. Guys, I would like to have your attention here. If you guys can stop talking. Guys, please pay attention to here. Please, I would request everyone to please pay attention here. Okay, let's call for our second kid, Vansh. Surya Vansh, okay?
Namaste, my name is Vansh. I am in 4th grade. Part 3 of the Indian Constitution describes our fundamental rights. There is a painting of Sri Ram, Sita ji and Lakshman ji on this part. This painting demonstrates how Sri Ram established Ram Rajya. Similarly, the Indian Constitution grants Indian citizens freedom from all types of discrimination as per equal rights.
Awesome bunch. Good job.
Thank you, Vansh. It is so amazing. Our third case is Jay.
Hi, my name is Jay. I'm in 4th grade. The scene of a conversation between Arjun and Lord Krishna on the chariot before the battle of Mahabharata is illustrated at the beginning of part 4, which is about directive principles of state policy. Lord Krishna in the 3rd chapter of Bhagavad Gita tells Arjuna that he should not only must understand his dharma but also perform duties of his dharma. An effective government must not only create laws but enforce them as well.
Very nice, thank you. And I don't know how many of you guys know, but all these pictures are directly from our Constitution of India. These pictures are the real part of our Constitution and these kids are just explaining it. So let's call our 4th kid, Vian. No, Ashi, sorry. Ashi. Ashi.
Patam Saranam Gacchami. Dhammam Saranam Gacchami. Sangam Saranam Gacchami. The enlightenment of Buddha and his disciples is portrayed on part 5 of the Constitution, which is about the union, which deals with the roles related to the president and the vice president. It shows Gautam Buddha giving sermon to his 5 companions at Sarnath. This was the first ever sermon that Gautam Buddha gave after attending the enlightenment. Sarnath is an important place in our country. Enlightenment can also be understood as the awakening of the human race from innocence to consciousness. And in addition to that, Buddhism also plays an important role in state diplomacy.
Thank you, Ashi. Thank you so much. Now our 5th grade, Inaya.
Namaste. My name is Inaya. I am in kindergarten. This image of Nasraj is seen on part 12. This part is dealing with finance, property and commerce. It reminds us of the commerce and trade of the great Cholas, and it also have a river swastik. Jai
Hind. Very nice. Thank you, Inaya. It was so sweet. Now our next kid, Krish.
Namaste. My name is Krish. Namo Arihantanam, Namo Setanam, Namo Ariyanam, Namo Vijayanam, Namo Loe Savesanam. Eso Panchanamo Karo, Save Prana Pranasaro, Maglavunche Savesin, Paramahye Mangalam. Jainism is a school of spirituality that focuses on ahimsa as a means to improve and help man with his conduct. In this picture, we see the 24th Tirthankar Bhagwan Mahavir in a meditative pose. This illustration is from the edition of Constitution of India. Mahatma Gandhi used ahimsa as a weapon against the British Empire.
Very nice, Krish. Thank you. Now our next kid, Ziva.
Namaste. My name is Ziva and I am in 2nd grade. This picture shows a scene of rishis living in the forest near ponds and rivers. Citizens are reminded of their role in preserving and protecting the environment, which is also a fundamental duty by Article 51A of the Constitution. Thank you.
Very good. Jai Hind. Our next kid, Dhriti.
I'm in 5th grade. This photo, it shows Subhash Chandra Bose. He is seen in his military attire, head held high, saluting the national flag of India. All this is happening against the backdrop of the mighty mountains as you see fighter planes descending. The army illustrated here is the Azad Hind Fauj, or Indian National Army. During World War II, Bose led an Indian National Force.
Good job, Dhriti. Thank you. Next kid, Nivan.
Namaste, I am Nivan. In this image, Ashoka is seated on a mighty elephant as he heads out to preach Buddhism, with Buddhist monks preceding him. Also seen in the image are several attendants bearing gifts marching alongside the emperor in the same direction. King Ashoka plays a significant role in the modern Indian nation state. The Republic of India adopts two of the state's iconographic representations, the lion capital, which is the national emblem, and the Ashoka Chakra, or the Wheel of Dharma, which finds its place at the center of the Indian national flag from his empire.
Thank you, Vinay. Now, Alia and Aryan.
My name is Aliyah. I'm in first grade. Shivaji reviewed ancient Hindu political tradition, court conventions, and promoted the use of Marathi and Sanskrit languages. He was praised for his respect for women. Shivaji employed people of all castes and religions in his administration and armed force. Jai Shri Ram. My name is Aryan. I'm in kindergarten. Guru Gobind Singh was the 10th and last Sikh Guru. He was a warrior, poet, and philosopher. At the age of 9, he became the leader of the Sikh after his father died. His father was the 9th Sikh Guru, and he had 4 sons.
Jai Shri Ram.
Jai Shri Ram. Thank you so much, Alia and Aryan. Now our next kid is Hasvi.
Namaste, my name is Hasvi and I'm in 3rd grade. The image is showing the court of King Vikramaditya. The mighty ruler is seen seated on an elaborate throne as magicians and dancers perform, while animals and birds have also joined this indoor space filled with the melodious tunes of the harp. Other than the emperor and the performers, other members of the court also seem to be enjoying, also known as the Chandragupta too. He was a great patron of literature and arts. His kingdom spread far and wide, covering a major portion of South Asia, according to Chinese travelers who have left multiple accounts of the emperor's kingdom. His governance was remarkable, and although he was a criticizing Hindu, he was tolerant towards other beliefs and faiths. Thank you.
Thank you, Hasvi. Thank you so much. Can we have a big applause for all the kids? And now our last kid is coming, Kiani. Come on, Kiani.
Hi, my name is Kiani, and I am Gandhi Mahatma Gandhi, the father of the nation. This description of Gandhi is a reference to the Dandi March movement, where Gandhi, along with his followers, marched in a protest for unlawful imposition of tax and salt by the British administrators.
Thank you, Kiani. Can hold it. So I think this wraps up our presentation by the kids. Now we can talk about the answer. The correct answer was C, Ram Lalla Varjman. You know, Indian constitution is one of a very rare constitution where ideals of the deities, which are the physical manifestation of the deities, can attain judicial personalities in India. So it is a very different type of constitution. I think in the world only three countries allowed this, and one of this is in India. So that's why the correct answer is Ram Lalla Varjman. He himself fought the war, and this was a big war and he won it. So Jai Shri Ram. So I would like to call Kratika again. so that she can make aware. I don't know how many of you are aware of this Sanatan Dharma education program, but we do these classes bi-weekly in our temple right here. And lot of kids, I think around 25-30 kids come every time in this class, and it's such an amazing class, and maybe Kratika will add some more into it.
Yeah, so we have it every bi-weekly and we have a schedule to it. We have an app on it, so whosoever wants to register, we can give more information about it. And I would say encourage your kids, bring your kids. It's nothing wrong, it just takes few minutes, an hour to take your kids to the class. Every learning adds something to your kids, because in this country it's very hard for kids to learn these things, and we always search. I always search something for my kids. So we started it, and it is very good for you kids. So bring your kids, and I hope it will go good with your kids. Thank you.
Definitely, and my kid go here, and I can tell you, not even my kid, I also learn a lot in this class. There are a lot of things we do here, like a lot of mantras and even yoga here. Every time in the class they give you a new pose, and not only kids but parents are also welcome to do that yoga pose. So it is very entertaining, and lot of insightfulness to our culture and our religion, and telling them the meaning of mantras and stuff like that. So I would request everyone, there is no harm to come and, feel this, or come and join even for one class. There is no harm, and take your own experience and decide based on that. Thank you so much.
And we have a little kid birthday here, Ashish's son Viraj. So can we sing a little song for him? Viraj, come on. Happy birthday to you. Happy birthday to you. Happy birthday, dear Viraj. Happy birthday to you. Happy birthday, Viraj.
Thank you so much. Thank you. It is very special. Thank you.
We would like to have our beautiful performers here, Neelam and Chandni with kids. We have going to have a very lovely performances.
तेरी मिट्टी में मिल जाऊं गुल बन के मैं खिल जाऊं इतनी सी है दिल की आरज़ू तेरी नदियों में बह जाऊं तेरे खेतों में लहराऊं इतनी सी है दिल की आरज़ू
This was so beautiful. Thank you, Chandni, Neelam, all the girls, all the kids. I know Shivam is not here, but he's done all the hard work, so I wanted to give a shout out to him as well. Pratika, thank you so much. And now we're going to dive right into our experts who prepared 5 to 10 minute talks for you guys and lots of opportunities to ask questions, then followed by lunch. So first, I would like to invite our grand sponsors, Ambika, Sony, Dr. Sony. Thank you so much for supporting the event. And the mic is all yours.
Thank you, everybody. My name is Dr. Mika Soni. We're with Sony Family Practice. So we were doing some testing back there with sugars, blood pressure, and BMI. So I'm going to give a little talk about preventative medicine. So why should we see a primary care physician? So first reason is we want to stay healthy. So your primary care doctor can help you stay healthy. They can help set goals for you and set a goal plan for you. We want to manage chronic medical conditions to prevent complications. We want to screen for chronic disease such as diabetes, hypertension, high cholesterol, heart disease, screen for cancers, and vaccine recommendations. So see, these are some of the reasons why we want to see a primary care physician. So screening today, we did a BMI, which is a screening for obesity. We did the random sugar test, which was screened for diabetes. And we did some blood pressure checks for hypertension. So BMI, the first thing that we did was a BMI screening. So you can see this is the scale. If you guys have your papers, we gave everybody a paper with their scores on it. So to interpret those scores, if you're under 18.5, that means you're underweight. So we encourage you to have more protein in your diet and to increase those calories. If you're from 18.5 to 24.9, your BMI is perfect. That is our goal. If you're at the 25 to 29.9, you're slightly overweight. So we talk about decreasing that carb intake, breads, rice, pasta, sugary juices. And if you're over 30, that's considered obese. So we'll have to talk about a treatment plan with your doctor. And if you're over 35, that's even more concerning. That puts us at risk for chronic diseases. So diabetes, what is diabetes? You guys might have heard that term. So diabetes is where the body's ability to produce or respond to insulin is impaired. So it results in high sugars in our bloodstream and in our sugars. So what increases my risk of having diabetes? So if you think to yourself, what are my risk factors of having diabetes? So one is age. So once we get to that 45 age mark, we are at a higher chance of having diabetes. So age, family history, if someone's parents, siblings, children have diabetes, cousins, that puts us at a higher risk of having diabetes. If our BMI, that chart that we gave you, if your number is over 25, that puts us at a higher chance of having diabetes. If you have hypertension, if you're a smoker, if you live a sedentary lifestyle, meaning you don't exercise, you don't go out and walk, you're not doing any physical activity, that puts us at a higher risk of having diabetes. Our diet, if it's full of carbs, meaning breads, rice, pasta, so we want to decrease that. Our ethnicity, so we are of descent of Asian American. So just with our culture, we are at a slightly higher risk than a person that's not the same culture as us. If you have low HDL or if you have diabetes during pregnancy, this also increases your risk of having diabetes in the future. So what are risk factors that we can modify, that we can help prevent us from getting diabetes? The BMI, we want to get that to be under 25, so that's number one. We can also stop smoking or don't start smoking, that'll decrease our risk, and have a low-carb diet and exercise. Try 5 minutes a day, increase your physical activity, you want to get to 30 minutes a day every day. So this is a little bit of a diabetic food pyramid, so we encourage eating more vegetables. So if you look at the bottom, that's the biggest piece of the pyramid, so that has all vegetables. So we encourage you to eat lots of vegetables. If you have a plate of food, more than half of that should be vegetables. And then we have healthy fats and proteins, so nuts, cheeses, meats, chicken, turkey, and we want to avoid too many carbohydrates. This is when we are a diabetic. But if you're pre-diabetic or you're trying to cut your weight, you want to do more of these vegetables in your diet. So what is the difference between type 1 and type 2? Some of you might hear somebody's type 1, somebody's type 2. Type 1 is when we don't produce any insulin at all. So typically we're born with, they were diagnosed at a younger age. Type 2 is diagnosed later on, where our body's ability to respond to insulin decreases. So that's the type 2 that we get later on in life. So we also did some blood pressure measurements today too. So if you look at your the little paper that we gave you, normal is less than 120/80. So if your blood pressure was less than that, you're perfect. So then we have the yellow, which is elevated, but it's still not at a hypertensive range. It's 120 to 129 and under 80. That's still in an okay range. The orange one is when we're starting to get pre-hypertension. We don't have high blood pressure, but we're in that little window. So that's 130 to 139 over 80 to 89. So again, that's kind of a gray area. But once we get to 140 over 90, either number higher, that is considered, could be hypertension. But you need 2 readings. So if you had an elevated number on that paper, please see a doctor. So hypertension, what is it? It is a common health problem. About 46% of adults have hypertension, and this is also age-related. So you can see 76% of adults from ages 65 to 74 will have hypertension. That number increases when we're over 75 to 82%. So hypertension is a very common disorder. So factors that increase my risk of hypertension: age, again, that 45 number. BMI, this one is a little bit higher, it's greater than 30. Family history, race, so this one we are not at an increased race with our race. High sodium diet, so if we have more than 3 grams of sodium per day, if we're drinking alcohol, we're not active. If we don't sleep, sleep is a big one too. So if you're lacking sleep, that can increase your risk of diabetes too. You want to get at least 7 hours of sleep a night. Smoking, and then if we have low socioeconomic status, increases our risk too. So modifiable risk factors, how can we prevent hypertension? Decrease our salt, increase our activity, decrease alcohol, and don't smoke. So some preventative testing. So these are things that we should be doing as we get older. So mammograms, this is number 1. So anybody that's at age 40 and is a female needs to have a mammogram. So these are guidelines that are every 1 to 2 years. When we're in our 50, it's every single year to get a mammogram. And these are screening tests, they're covered by your insurance. Your primary care doctor can order this. It is a screen for breast cancer. Breast cancer is one of the most common female cancers. So this is preventable and treatable. DEXA scans for osteoporosis screening. This is for thin bones. So osteoporosis, again, it's a common problem. Anyone that's 65 or over that's a female should have this test done. It tells us the thinness and the thickness of the bone. So this is to help prevent fractures. So the most common sites of fractures that we see is the spine. So sometimes if you have a mom that's having back pain, it could be a fracture if she hasn't had a bone scan. So definitely bring everyone to get bone scans. Again, it's covered by Medicare, it's covered by your insurance, and it'll help prevent fractures. Pap smears, so these are screens for cervical cancer. This is totally preventable as well. We start at age 21. We continue at a 3 to 5 year cycle depending on your results. And again, these are covered. Your primary care doctor can do this. If not, an OBGYN can do this. Colon cancer screening. So guidelines have just changed because we're seeing a lot more colon cancer lately. So now that we start at age 45 as to compare to 50. So 45 is that magic number that we're seeing. So if you're at that age, you want to start talking to your primary care doctor. So colonoscopy is a golden test. It's a test of treatment and screening. So if they find a polyp, they remove it and you're good. It's the 3rd most commonly diagnosed cancer in males and the 2nd most common in females according to the WHO. So please get your colonoscopies done if you have not gotten one. Prostate screening. So this is the 2nd most common cancer in men worldwide. It is 11% of males are diagnosed with prostate cancer over their lifetime. Your screening begins at age 50 and it goes up to 69 per USPSTF guidelines. And if you have a family history, you want to screen earlier. So vaccines, this is another thing that you can talk to your primary care doctor. You might hear a lot about different vaccines. So adults over 18, you want to do your influenza or your flu shot yearly, meaning every year you want to go ahead and get your flu shot. The Tdap is every 10 years. The COVID vaccine, that's based on recommendations, so please follow your doctor's advice on that. And the HPV is another vaccine that we do recommend. It helps prevent certain types of cancers. It was till 26, now it's up to 45 that it could be covered. On the other side, we have adults greater than 65, so there's a pneumonia shot. So you can either do the PCV20 or you do the PCV15 and the PPSV23, which are given a year apart from each other. Those satisfy the needs of the pneumonia vaccine. Influenza, we want to recommend the high dose, that's specifically for 65 age and older. The COVID is based on recommendations. The Tdap is every 10 years. The shingles is another vaccine that's out that's covered by Medicare. It's a 2-dose series within 6 months apart. And RSV is in that high-risk category that's given to patients over 70. Lung cancer screening, so the recommendations changed in 2021. So we want to do anyone that's a smoker for more than 15 years, you want to do a low-dose CT annually from ages 50 to 80. Abdominal aneurysm screening, so this is for all men that have smoked. It's a screen for an aneurysm which in the stomach can rupture, meaning it can pop. So this is to check to make sure that we don't have an abdominal aneurysm. And it's for all men. If somebody has a family history, there are 2 to 3 times higher chance of having this. This is totally preventable. Depression screening, so this is a very important topic. So annually or once a year we do this in our practice. If somebody has a positive score, we do it more often. But mental health is very important and you can talk to your primary care doctor about it. Blood pressures we talked about already. Diabetes we talked a little bit about too, so we can diagnose it by an A1C, a random sugar greater than 200. I talked to some of you today that had that higher than 200 level to please see a doctor. And then if you have fasting sugars greater than 126. Physical exam, you should have this done yearly with your primary care doctor. They do a full body check. They go through all these routine health maintenance that I just talked about, and it's specific per age, per patient. These are some of my references. Thank you.
Thank you, Dr. Soni. Thank you so much, so much. Any questions? She'll be in the back for questions, and then we can keep going. If that's okay. 2 questions.
We can just do 2 questions here, and after that we can ask them.
Vaccines that you mentioned earlier, sometimes the doctor or the pharmacist has to go for more vaccines. Is there like a standard rate for that? I was watching your screen. Like you said, every 10 years, but then they come and say,
Neelam is going to cover vaccines more in detail, so mine was just a quick topic. Good question, very good. Thank you so much. I'll be in the back if anybody has questions.
Thank you so much, everybody. Next. If we can have some silence in the back so everybody can hear. Thank you so much. Anushka, she's a physical therapist at Orlando Health, is going to talk about fall preventions. Sorry.
You've had a long day. Hello everyone, my name is Anushka. I work as a physical therapist with Orlando Health. What I'm going to be talking about is fall prevention strategies. How many of you in the crowd have ever experienced a fall, loss of balance, or how many of you in your family have seen someone have a bad fall? I'm going to have you raise your hands. Perfect. So you can see how stressful this can be when your loved ones would have a fall. So what I'm going to do is I'm going to cover the important things that you need to make sure to prevent any falls in future. So most common reasons for fall would be loss of balance. Why would someone have loss of balance? Your balance is lost because you have a vitamin D deficiency, osteoporosis, lower extremity weakness, vision deficits. Your balance is maintained by 3 major things: your vision, your vestibular, and your sensory. If as you age, your sensory deficit begins, and you want to make sure that your vision is intact to prevent falls in future. So my next presentation is going to be about how to prevent falls. First and foremost, majority of the falls will happen in your home. Believe it or not, majority of your falls happen at your home. It is very important that you make sure your home is safe. How do you do that? You make sure there are railings. In the next slide, there's a nice image which shows grab bars where you can hold on to something. Getting up from your chair, getting up from your bathroom, getting up from your toilet seat. It is really important to have grab bars or something to hold on to it to make sure you don't have a fall. You need to put railings on both sides of stairs. Use a cane, use a crutch to walk. The most important thing I want all of you to focus on is no matter how small the distance is. I repeat, No matter how small the distance is, use your assistive device. Use your crutch, use your cane, use your walker. Majority of the patients that I see in the clinic are patients who had fall when they were sleeping and they're like, oh, let me rush to the bathroom. It's probably like 50 feet. But that 50 feet distance, you just wake up in the middle of the night, you don't have balance, you don't have enough light in the room, that makes you very susceptible to falls. Use your crutches and your canes. If there's one thing that I want you to take from this presentation, is please use your assistive device. There's no harm in using a walker or a cane. That's going to make it much more better than you having a fall, breaking your hip, breaking your knee, breaking your bones. With age, you tend to be more osteoporotic. Now, how do we make sure that we're strengthening your bones? So, thank you. So these are some weight bearing strategies. These are easy things that you can do at home. You want to make sure you're holding onto a countertop, you're making sure you're holding onto something sturdy and just marching in place. As easy as marching in place, as easy as walking, as easy as just lying down on your bed. If it's hard for you to go on the floor, use this mat, use your bed. Just do some bridges. Weight bearing exercises have known to improve your DEXA scans by 30%. So it's really important to keep doing all your weight bearing activities. Upper body strengthening. When you're trying to get up and you have lower extremity weakness, how do you get up? You use your upper extremity, you use your hands. The best way to strengthen your hands would be some balance training, some more strengthening with your bands. Use your resistive devices. So I've just kept some pictures over here. Feel free to take pictures of these and you can follow these at home as well. Another very good method to strengthen your body is a recumbent bike. And I'm mentioning the word recumbent bike because I don't want you to go on a regular bike. Using a bike which has good back support is extremely important, which prevents your chances of low back pain. I'm sure a lot of us are having low back pain by this age. So we want to make sure we're using a recumbent bike to keep our back safe as well. Deep breathing. When you go from a laying down position to sitting up position, a lot of us experience dizziness, a lot of experience vertigo. Make sure we sit for a minute, make sure balance is more calm and composed, and then get up. We're in no rush to go anywhere. I would rather you're safer than you just have a fall and... The last but not the least is gait training. When you're walking with your crutch or a crane, make sure you're taking good long steps. A lot of us tend to take shorter steps and walk faster like this. That is something that prevents you to maintain your balance. Your body is walking very faster than a normal speed it's supposed to, and it leads to higher chances of falls. Thank you so much. That's all I have for you. Thank you. Do we have any questions? Thank you. And I know you're around if somebody has any questions, and you're happy to show them exercises too. Yes? Okay. Well, this is a really nice segue into our next topic. So let me introduce Dr. Shuchi Chaudhary. She's our stroke neurologist at Orlando Health, who's currently on stroke call. So, happens to be a stroke call. So yeah, all you, Shuchi.
Hello everyone. Thank you, Kapi, for asking me to give a talk. So today I will be talking about stroke. Anybody in the audience have family members that suffered a stroke? Okay. So, we'll go over some of the important things. I kept it very short and I would appreciate your attention. So just a few slides, but we'll be talking about it. So what is a stroke? Can anybody tell what is a stroke? I'll tell. So a stroke happens, so there are two kinds of stroke. There is an ischemic stroke and there is a hemorrhagic stroke. Ischemic stroke occurs when there is a blockage to any blood vessel because there is lack of blood flow, there is lack of nutrients that need to go in a specific area of the brain that causes a stroke. The other one is caused by ruptured blood vessel, which is a hemorrhagic stroke. Okay, so okay, so ischemic stroke. I just put a little picture over there. The first picture shows an ischemic stroke. That's a little blood clot, the yellow clot that is causing lack of blood flow to that particular area of the brain. And in that particular area of the brain, your brain cells die. Okay. The other one is a weak blood vessel that causes rupture, and there is that area of bleeding. Okay. So when that happens, part of the brain cannot get the blood that it needs, and the brain cells die. Okay. What is a TIA? I'm sure you've heard about the term TIA, mini stroke. To me, as a stroke doctor, a mini stroke or a stroke, it really doesn't change anything. If you had a mini stroke, you need the same kind of medical attention that a stroke patient needs, because it's a warning sign. It's a transient, temporary episode. Okay? And up to 80% of the strokes can be prevented. So that's where primary care comes in importance. Okay?
Yeah. No.
So what are your risk factors? Who are the people at risk? Unfortunately, Indian people, Southeast Asian people, we are at very high risk of strokes and heart disease. Okay? Your risk increases with increased age. So older people, this is traditionally a disease of older people. So the more aged people are unfortunately at higher risk. Men are at higher risk than women. And if you have family history of stroke or TIA or heart disease, it's the same process that causes all of these things. So these are the risk factors that we cannot do anything about. Okay, we will all age. Sex is something we can't do anything about it, and family history. But that is very important. The modifiable risk factors is where I want you guys to take charge of your health. So modifiable risk factors are high blood pressure. Number one reason for strokes and brain bleeds is hypertension. Okay? So check your blood pressure, make sure you're on top of it. It really sneaks up on you very fast, and most often it's asymptomatic. We see people, younger people, like in their 40s, 50s with brain bleeds, and they say, oh, my blood pressure has always been good. What is good? I've never felt anything. Of course you don't feel anything with high blood pressure. Okay? So it's basically what we say is, if you don't take your car for detailing, even the car requires servicing. So your body is a machine. It requires servicing. So hypertension, high cholesterol, diabetes, those three are really big risk factors. Cigarette smoking, atrial fibrillation, it's irregular heart rhythm. If you've ever been diagnosed with irregular heart rhythm, that is a very high risk for stroke. Okay? Carotid stenosis, which basically means blockage in your carotid arteries. Obesity, being overweight. Metabolic syndrome, it's just a generic term where you have all these risk factors. You lead a sedentary lifestyle, there is lack of exercise, there is lack of, physical activity. And then drug use, which I don't think it's a problem here. 1 out of 3 American people have those 4 risk factors, which are, the top risk factors. So, how do you know it's a stroke, right? What are the signs and symptoms of stroke? You have sudden onset of weakness on one side of the body, sudden onset numbness on one side of the body, slurred speech, facial droop, suddenly your face looks asymmetrical, vision changes, particularly loss of peripheral vision. Like you will see people, this is how we get these people, like they can't see on one side and they're like bumping into walls because they don't know where to go. Or they can't find the bathroom in the house and they're like making circles. So that is because of loss of peripheral vision. Or complete or partial loss of vision in one eye, which is mostly painless. Painless loss of vision in one eye could be a stroke to the eye. Okay? Difficulty talking or understanding, which is called aphasia, is when they can't get their words out. This is what you will see, like they're trying to talk to you, but they can't get their words out. Or they are saying some things that don't make sense to you, okay? As if they're speaking a foreign language. severe headache with no other cause or loss of consciousness associated with a headache. It could be a sign of bleeding stroke. Loss of balance or sudden difficulty walking is also a sign of stroke. Okay? So spot a stroke. If anything, I want you to remember this slide. It's be fast. Okay? Be fast are the signs of stroke. B for balance. E, eyesight loss. We just talked about that. Facial drooping. F. Arm weakness. You tell them to put their arms up, both arms up, and if one arm goes down or it like flops down, you can clearly see it's weak. Or same thing for the leg. Speech difficulty, which could be slurred speech, difficulty getting your words out, or saying stuff that doesn't make sense. T is time to call 911, okay? One thing I really want you guys to take away from this talk is anytime you are thinking a person is having a stroke, don't wait. Don't try to find your car keys, go, here and there and call 911. That's the most important thing you guys can do to save somebody's life. So what to do when someone is having a stroke? Call 911. I want you to really remember that. Even if it's in the temple, on the road, in the mall, anywhere. Why is it important? Several million brain cells die every minute. Every minute on the clock is important, okay? Patients can get life-saving treatment. If you make it to the hospital within 4.5 hours, you can be eligible to get a clot-busting medicine, which improves your chances of not developing disability from stroke by 35 to 40%. That is a big number, okay? The reason why you should call ambulance is because those people are obviously trained to handle an emergency. If your loved one stops breathing, if their heart stops, those are the people who are trained to do all this. They have the ability of activating the alert system in the hospital even before you get there. So we get stroke alerts even before you guys come to the hospital, so we're ready. Everybody is ready. It's a very coordinated team that takes care of you or your loved one when you guys come to the hospital. And what I want you also to do is always know, anytime you're seeing a stroke patient having a stroke, first thing you do is look at the clock. Look at the time when their symptoms started. It's very important for us. Sometimes when we can't help when we don't have that information, okay? And know their list of medications and be available by your phone when we try to reach you, because we're trying to help the best we can. Spot a stroke, save a life. That's it. Thank you.
Thank you, Shuchi. This was very, very important topic which was covered. Please, सबको अपने stroke के signs पता होने चाहिए. We are all at an age जहाँ पे we all can have that. So all these signs and symptoms we should be aware and immediately call 911. It can be not prevented, but it can be treated well.
Thank you, Alka. Next, thank you so much, Shuchi. Next, we'd like to invite Dr. Neelam Zala. Did I say it right? She's an infectious disease specialist at Orlando Health for a very brief vaccine update.
Good afternoon, everyone. I'm Neelam Jala. I'm one of the infectious disease physicians with Orlando Health System. And I'm very briefly going to talk about vaccines and here to answer any questions you may have on basic vaccinations. So why is it important to get vaccines? Is there anyone here who hasn't received COVID vaccine? I hope everybody did. Yay. So why is it important to get vaccinated? Because for hundreds of years, ever since different vaccines have been in market, it is already proven by different studies that the vaccine do save lives. Vaccines are the best way to protect yourself and your loved ones because it prevents so many different vaccine preventable diseases. And it can also help you avoid serious illnesses. Those are some of the main reasons you should get vaccinated. So I'm going to briefly talk about COVID vaccine. As we all know, and I'm sure all of us have received COVID vaccine multiple times in last few years, ever since COVID pandemic started. But for the current guideline, what is there we need to do? So everybody should get current COVID vaccine booster shot, which could be from Novavax, which is one of the brand which is making the vaccine, or Moderna or Pfizer, which we probably are all aware of popular names. J&J vaccine, some of you might have received a few years ago. It's no more valid and recommended by our Infectious Disease Society and CDC. So I would highly encourage that we get Novavax, Moderna or Pfizer, one shot. Especially everybody who is 5 years and older. The kids who are 6 months to 4 years of age, they have a different set of vaccination guideline, and which you can discuss with your pediatrician or can chat with us like infectious disease specialist. Other than that, those who have serious medical conditions, underlying health issues and multiple health issues, cancer, diabetes, high blood pressure, chronic kidney disease, those who are on dialysis, they have a little different guideline for the vaccination. Not just one dose of COVID vaccine, but they should be getting 1 or 2 extra doses of COVID vaccine. Again, that is more based on your individual diseases and conditions. So please have a talk with your primary care doctor or infectious disease specialist if you have any questions. Some of the basic questions which I get asked about COVID vaccine multiple times. So can I choose which COVID vaccine I can get? Yes, you can. You can decide whichever vaccine you want to get out of all 3 different options I mentioned. And you can also mix and match if that was your concern or question, that whether I have received Pfizer before and then second dose was Moderna and can I get Novavax? Yes, you can. Do I need to wait after getting flu vaccine or any other vaccine before getting COVID vaccine? The answer is no. You can get other vaccines with COVID vaccine. You can get your flu shot, you can get RSV or other vaccines if you are eligible for, which I'm going to talk briefly about. But you can combine those vaccines with COVID vaccines. It is safe to get it together. Can I get vaccinated while I am currently sick with COVID-19? No. You should wait until your symptoms completely resolved. You should wait until your isolation period is over, which is depending on how sick you are, whether or not you needed hospitalization. It could range from 7 days to 15 days. And once you feel better, you should get COVID vaccine. Now, some of the patients do ask us very frequently, I already had COVID multiple times. Do I still need to get vaccine? And the answer is yes. The reason is, even though you had COVID, the immunity you're getting from actual COVID infection is going to last only for a few months or few weeks. So you need to get vaccinated down the road in 2 to 3 months to improve your immunity and to improve your chances of not getting COVID again in future. Next slide. Then influenza or flu vaccine. Everybody who is 6 months and older, be it 50, 65 or any other age, should get 1 dose of influenza or flu vaccine every year during the start of the flu season, which is usually end of September till we recommend in March, depending on how the season is going on. Especially nowadays, we are seeing a lot of influenza A, flu A patients in the hospital, getting really sick, getting in hospital with other type of pneumonia combined with influenza, which is usually a very common presentation for flu. So that is why we highly encourage that you get flu vaccine every year. There are different variety of flu vaccines, and again, studies have shown that either one you get, they have similar efficacy, that means the similar result. So you can choose either one of them after talking to your primary care doctor, but make sure you do get flu vaccine every year. The next one is shingles vaccine, herpes zoster. Some of you might have had that condition, especially those who are immunocompromised, means their immunity is down because of any other underlying condition, whether it is diabetes or whether it's end-stage renal disease or whether they have lymphoma, leukemia or any other cancer. They are at higher risk of getting shingles, which is herpes zoster in our medical term. So the vaccines are available for shingles for adults who are 50 years and above, and there are 2 doses given for the vaccine. You can receive 1 dose and the second dose can be between 2 to 6 months. Again, you can discuss with your primary care doctor whether to receive this vaccine and when to receive, but it is one of the recommendations for shingles. And then RSV is one of the newer vaccines available in the market, especially those who have many other underlying comorbidities, diabetes, high blood pressure, cancer, end-stage renal disease, lymphoma, leukemia, or those who are elderly and getting different kind of infection again and again, requiring multiple hospitalization again and again, or those who are living in a nursing home facility. This is something is not a universal recommendation, but it is individual basis. You can discuss with your primary care doctor or infectious disease doctor, and after the discussion we decide whether it is appropriate for you, but something to worth talking to your doctor whether or not this particular vaccine is good for you or not. And this is the whole chart. I think one of the gentlemen here asking about how do we know which vaccines we need to get. So this is all different kind of vaccines, especially for adults. Again, children immunization is little different, but these are the vaccines recommended for all the adults in different age group, which we already discussed: influenza, RSV. One of the other vaccine is Tdap. You might have heard that. That includes tetanus, diphtheria, and pertussis. So many of you are going to be or already have become grandparents. And if you are having a grandchild, you want to make sure you're protecting your babies, grandchildren from pertussis and diphtheria. Those are preventable conditions and diseases. So you are recommended to get those vaccines, especially if you haven't received Tdap vaccine. We already spoke about zoster. MMR is in a different age group. Pneumonia vaccine. Everybody should talk to their primary care doctor about pneumonia vaccine. There are 3 different varieties of pneumonia vaccine. Especially with many underlying health conditions, you should be eligible to get one of the pneumonia vaccine. And then hepatitis, meningitis vaccine, and H influenza. Those are the different vaccines for different age group. I want all of you to know that there is something we practice as an infectious disease which is called travel medicine. That means depending on where you are traveling, which part of the world, there are different diseases and conditions are more prevalent there, which could be prevented either by vaccines or by taking a prophylactic medicine. So always have a chat with your primary care doctor before you travel to see either you need to get some of the vaccines for travel, or if either you want to be on some preventable medical medicines, so that you can avoid those diseases or conditions when you are traveling to those countries where some of the diseases are more prevalent. I guess that's it. Any questions? Yes, sir.
How often you need to take shingles vaccine?
How often do you have to take shingles vaccines?
So shingles vaccine, as I just mentioned, is 2 doses. You don't have to take often. It's just you take those 2 doses and that is it. You have to take those 2 shots within 2 to 6 month period. And once you receive those, that should be good enough to give you further immunity. Any other questions?
You have listed 3 types of pneumonia. So if you have taken either or all, then that's the lifetime. You don't have to take the second dose.
No, that is not true. The question was, there were 3 different types of pneumonia vaccine listed on my chart. So we do have 3 different varieties of pneumonia vaccine in the market, but it depends on which one you received, and you have to get repeat dose of one of them. I don't think we have time to go in detail of it, but 23 monovalent, 20, and there is one more which is combination of 2 different type of pneumonia. So what you need to do is talk to your primary care doctor and ask them, depending on what you have received 5 or 10 years ago. If you have received 23, which is the newest one, then you probably do not need other doses. Thank you.
And she's around for additional questions that you can ask her, so thank you very much. Next is Dr. Shilpa Pandey. She's our sleep medicine specialist who is going to talk to you about sleep apnea awareness. Yes, all you, Shilpa.
Thank you. Hi. Everyone tired? I hope my talk puts you guys to sleep. I'm just kidding. While we bring it up. So my name is Shilpa Pandey. I just opened a new practice for sleep medicine in town. So I practice for pediatric and adult sleep, and very quickly just talking about. So are you moving? Moving the mic, so yeah. Hold it more. Move away. Okay. All right. So snoring. I think there's a lot of question about, is snoring normal? So snoring, a lot of us snore, and on an average, I would say like 1 in 10 people snore. But it's not always a problem. But if it's happening consistently, if you're having any other associated symptoms with it, then you should get checked out. Next slide, please. So what is sleep apnea? Sleep apnea means that you're stopping to breathe during sleep. In a nutshell, that's what it means. A lot of times you'll notice the person sleeping next to you is snoring, gasping for air, making too much noise, and you have to leave the room, or there's a lot of complaints in the morning. Then you should get checked out. Or sometimes they're gasping for air, right? So physiologically what's happening is in the back of their throat there's a collapse happening and they're stopping to breathe and oxygen is dropping, and that's why it's a concern. So we should get checked out. But we'll talk about the symptoms that you should be looking for. So there are 3 types of sleep apnea. The first one is central, which means that there's something wrong either with your brain or with your heart, and that thankfully is less common. The more common one is the obstructive sleep apnea, which means that in your airways the air is not passing. So it could be in children. The most common reason is enlarged tonsils. And then in adults, it can just be because of age, because of weight. So a lot of weight, if you're really overweight, a lot of weight on your neck, then you can have sleep apnea happening because of that. And then there is a type which is called mixed apnea. Obviously, it has features of both. Next slide, please. Okay, so what are the most common symptoms that we're looking for? Now, sleep apnea can present in different ways. But in adults, if you're snoring quite a bit, pauses in breathing while you're sleeping, a lot of complaints in the morning from your bed partners, if you're excessively sleepy during the day, so if you're having to take naps during the day, if you're having to drink a lot of coffee during the day, otherwise you feel sluggish, that could be a reason that you're not getting enough sleep or good enough sleep at home at night. So that could be something that you need to get checked about. And then if you have high blood pressure, diabetes, obesity, and you are having difficulty controlling those. So even though you're on medications for hypertension or for diabetes or trying to lose weight and it's difficult, maybe it's an underlying sleep problem that you have and you need to get checked out by sleep. So other things would be like forgetfulness, typically difficulty remembering things, memory loss, acting out dreams, really bad nightmares and things like that could be a sign of sleep apnea. Waking up with headaches in the morning is concerning. So if you're waking up with headaches on a consistent basis, that would be a reason to get checked out as well. In children, sleep apnea is common as well, and the symptoms or the presenting signs are a little bit different. So they're really small babies can have sleep apnea as well, but they have more central type like we talked about. Older children get more obstructive type because they have the tonsils being enlarged. But they can present with bedwetting, difficulty focusing, falling asleep in school, grades falling, things like that should alert you to talk to your primary care to see if a sleep problem could be the underlying issue and if they need to get checked out. Okay, so again, we're just talking about that it can be in pediatrics as well, so keep your eyes open. Next slide, please. Okay, so how do we diagnose it? Definitely physical exam. When I see the patient, I'm looking at how they are, their weight, we're looking at the BMI that Dr. Soni had talked about, and then we're looking at the lifestyle as well. So if they're smoking a lot of drinking, that can cause you to have sleep apnea And then there are some questionnaires that we fill out that give us some idea of if you should be tested or not. There are sleep studies that we can do, so we can do sleep studies at home, where a device is given to you and you can go home and sleep at home in your comfortable bed, and I can remotely, get the results, and you don't even have to come to the office to give me back the machine. So there are different machines available. If your sleep apnea is more concerning, and if I feel like you need more specific testing, we may bring you in and keep you in a lab and watch you sleep. I'm just kidding. We just put a lot of wires and monitor. Next slide, please. So the treatment of sleep apnea is varied depending on what kind of sleep apnea you have and your age as well. So pediatric patients, we try to keep away. We try to do the surgeries because that's the most common reason in large tonsils. So we remove the tonsils and adenoids. We try to do that. And then weight loss is the other thing. And then everyone has heard of CPAP, the machine that patients wear. And people are worried about it and they don't want to wear a machine, so they don't want to get tested. But that's not the right approach. And there are different machines, there are different masks available. So, get tested if you feel like you may have it, and we can work with different types of machines and find the best one for you and keep you comfortable and healthy. But then of course, not forgetting the lifestyle, we want to have an ideal weight. So work on our weights, and then certain positions help with sleep apnea as well, certain times sleeping on the side. So it could be an easy answer depending on what kind of sleep apnea you have and what level, if it's mild, moderate, or severe. And that's it. Thank you so much. Any questions?
Thank you so much. We are running a little bit behind. If you guys have any questions, our expert is here right now. Okay, so I'm going to introduce our next speaker, that is Dr. Monique Kumar. She's our dermatologist. To have an Indian dermatologist is little, rare, but we have her. We all think that we do not need sunscreen. That's a myth. Please listen to Dr. Monique.
Hi, everybody. All right, so I have got a lot of prizes for the kids, and especially if they pay attention and they don't make noise. I have 2 children of my own. I am a pediatric dermatologist, fully trained in adults as well. I just like kids more. So I'm going to talk today about something that I think most of us in this room probably ignore. How many of us wear sunscreen every day? All right, so 10%. We all should be wearing sunscreen regularly. There are 2 types of UV rays, UVA, UVB. That's pertinent to this talk at least. UVA is about aging, A, aging. UVB is burning, B, burning. So it's true, most of the time we don't burn. It doesn't mean you cannot burn, but most of the time we do not burn. But you do age. You get tons of UVA every day. So you should be wearing an SPF of 30 or above daily. And then another complaint I get is often, I just can't find sunscreens that work for me. They're all white, or they're all this, I don't know, they're meant for white people. There are so many different sunscreen brands now. So first of all, if you don't have sensitive skin, you can wear chemical-based sunscreens. Those rub in fine. If you have sensitive skin, I do recommend physical blockers, which are titanium or zinc. But you don't need to wear the ones that make you white. They're the white paste. There's tons of tinted sunscreens. They're very elegant. They come in all sorts of price ranges, and that can come from brushes. They can be tinted moisturizers. There are so many options, and I brought lots of samples because I want you to try them. I brought some of La Roche-Posay samples and some CeraVe samples, but they're all different price points. You can spend $5, you can spend $120. It's all the same thing. So what I would say is every morning you should put on something with SPF 30 or above. It is an exponential difference. So there's a huge difference between a 15, a 20, and a 30. Not a big difference between a 30 and a 100. You're already protecting yourself from 99.5% of the rays when you put SPF 30 on. So putting a SPF 100 on is not that big of a difference. So I have tons of stuff up here. I brought several raffles. I really want people to start wearing sunscreen. Again, you can get burnt. There's talks all about different skin types. There's some skin type 1 to 6. I'm a skin type 4. Many of y'all are 4, 5, or 6. You can burn. I have burnt before. You need to wear sunscreen daily, even if it's not, if you're worried about skin cancer. That's not why we wear sunscreen. We wear sunscreen for many other reasons than that. All right, so I'm all done because I know everybody wants raffles and food, but I have tons of freebies, so please.
Thank you, Dr. Kumar. So please, she has all the stuff and we'll be helping her. Okay, now we have the last topic, which is an important one. We all should be aware of this. रास्ते में आप जा रहे हैं, कोई नीचे गिर जाए, how to do CPR, how to use AED. So these are very important topics. Dr. Ashish Gupta, our cardiologist, has taken time out to show us all these things. So please be silent. Food will be served. People on the right side. Now socialization is done. Almost the time for lunch. Please come in the middle and grab some seats. Please learn this. Thank you.
Thanks, Alka. So this is actually really, really important that we should all know how to perform CPR because this can truly save lives. And I will strongly recommend that if you have an elderly patient in your home, or if somebody has had a heart attack or stroke or have high risk of having the event, please invest some money and buy these AEDs, okay? And I will show you how to use these. Very, very simple, and they will save lives, okay? So there are two scenarios. One scenario is that you are by yourself and you see somebody with what we call as witnessed cardiac arrest, okay? So what does that mean? Is that patient suddenly became unresponsive, they are not breathing, and they are not really responding to you, okay? That is not the time to do foot massage, raise the legs up, or do the pankha thing which you see, okay? That's not the time to do that. That's the time to really get going. So first thing is that you quickly assess the patient. You go close to the patient, see if they are breathing or not, and feel their pulse. So you can feel your carotid pulse right here in the neck, okay? Or you can touch your wrist area, feel the pulse there, or you can try to feel the pulse in the groin. But the two important areas to check for the pulse is around your neck and around the wrist, okay? If you have a scenario where the patient is not breathing and they don't have pulse, what you need to do is you need to start doing chest compressions, okay? If you have somebody with you who can assist you, then that person needs to call 911 right away, okay? So 911 right away. If there is nobody with you and you are the only one, so then what you do is you first start doing the chest compressions, do them for 2 minutes, take a quick break, call 911, and start the chest compression again, okay? So you can dial 911, leave the phone on the side, the 911 operator will talk to you and they will send help, okay? So, how are you going to do the chest compressions? Okay? So the thing is, can everybody hear me? Yes. Everybody hear me? Okay, good. So what you do is if the patient is on the softer bed and if you have help, move them to the floor, to a hard surface, okay? If you can't do that, that's okay. So you can still do the compression, but having a hard surface at the back helps with good compression, okay? So what you want to do is, you want to lean next to the patient and make your hands like this. One hand on top of the other hand, and go to the left side of the chest. Okay? So just right around this area where your breast, your rib cage is ending. So right around that area, you're gonna put your palms on the chest, okay? And you're gonna start doing the compression. So it has to be 100 compressions in 1 minute. So really, really fast, and you have to push the chest wall in by at least 2.5 inches, okay? So this is how you're gonna do it, okay? So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So you're gonna count and see how hard I'm doing it. It's not gonna be like this, okay? So in many elderly patients, you can actually break the rib bones. That's how hard you wanna go. So really push hard. 1, 2, 3, 4. And in the dummy, when you guys come and do the practice, you will see if I'm doing it rightly, it's just giving a red light here. Now the patient is not going to have a red or a green light, right? So hard compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So 100 compressions in 1 minute. So that is the rate you want to go. Okay? Now, you've seen this in the movies that you have to do the rescue breath, right? So that is not important. So the most important thing is compression, compression, compression. Now, if you're comfortable giving a rescue breath to the patient, then it is 30 compressions and 2 rescue breaths. Okay? So how you're going to do the rescue breath is you're going to tilt the neck backwards a little bit, and you're going to open the mouth, okay? And then you're going to give the breath to the patient. So you take a deep breath and then give the breath to the patient. 2 breaths, right? So 2 breaths and then the compressions will begin. So you will continue this as long as you need to until the 911 comes to the rescue. So if you're getting tired, there is no harm in asking another person to take over the compressions, okay? Because that's one thing which you're not gonna stop, doing the compressions. What is happening with the compression is we are forcing the blood flow to the brain and to the major organs, okay? So that's why we are doing the compressions. Now, if you have an AED at home, which is very, very simple. So basically, the AED comes in this bag, right? So you're gonna take it out, okay? There is a battery. You quickly put the battery, there you go. It is ready and armed, right? So it will tell you what to do. So this is the pad cartridge. So it is telling me to insert the cartridge, and here we go. So now it is ready to go. So then it's telling me what to do. So take the pad, okay, and it tells you where to put the pad. So this one we have to put right here on the side of the chest, okay, and then the other one, it shows you exactly where to put. So it goes right here. Alright? So this is how the pads are put in. Okay? And now you're gonna still do the compression. That's not gonna stop. So once you are ready with the AED, you hold the compressions. The device is gonna check for an abnormal rhythm. If the device thinks that the patient has an abnormal rhythm, it's going to tell you to deliver a shock. And that is this button right here. Okay? So if it says deliver the shock, you press this button and the patient is going to get a shock. Okay? So once you get the shock, you start the compression again. Okay? So compression for 2 minutes. Wait for the device to tell you whether the shock has to be delivered or not. Okay? So this is really the basics of basic life support. So I hope you get the basic idea, right? Chest compression, 100 compressions for 2 minutes. Sorry, 100 compression for 1 minute, okay? And then you have to assess the patient every 2 minutes. So that's how you do it, okay? Now who wants to do the compressions? Any kids want to do how to do the compression? Okay, come here. Okay, so here, what you're gonna do is, you're gonna put your hand here, put this hand here, put this one on the top, and then push it down, hard, very hard. This is not working, right? So you have to push it here, I'll show you, right here, and then do it. Very hard. Okay, so put your hand here. Very good. So now you're doing something. Okay? Yeah. Very good. Okay, let's do 1 or 2 more and then we can move on. So you're not getting that compression. I'm not going to so here. 1, 2, 3, 4, 5, 6, 7, 8, 9. That's how it's going.
So this was really great. I hope none of us have to go through this, but we should be all ready with this exercise. Every public place is supposed to be equipped with AED, and we are so proud our own mandir has it. This AED is for mandir. So big round of applause for Durga Sai Temple, Durga Saab and Anita ji for giving us again this beautiful platform and providing us with everything. I would quickly announce my CAPI team. So my name is Alka Arora. I'm this year's president for CAPI, and I have my beautiful dream team with me who have helped us along with my CAPI members and my community, all of you. We could not have done this program together without anyone. Please, I have Dr. Nilima. She's our new president-elect. Next year she'll take over and she's excited. Shweta Gupta, Dr. Shweta Gupta. Dr. Shweta Gupta, she's our vice president. Then we have, who else is here? We have Dr. Charanjit Singh. He's our CAPI treasurer. And today we have Dr. Monique Kumar. She's our CAPI member at large. And of course, all of you and all my CAPI members and CAPI doctors, 3 cheers for them. And our audience, 3 cheers for all of you. And I cannot forget my strength, my husband, Atul. Now, okay, so if we have covered all the topics, we did not cover hip and knee replacement. Just in case if anybody has any questions, we have orthopedics in our group here. Dr. Ram will be in the back, you guys can talk. I cannot thank enough our main sponsor, Sony Medical Practices. They have done a fabulous job. They changed this whole thing. So 3 cheers for them. our morning event. And I cannot thank enough Archana Dabney. Archana is a person, she's in medical, what do I say?
So Archana is in Genentech. She has a lot of titles. I won't bore them with that. But thank you so much for all this background work and all your volunteer efforts. And the 12 midnight email that I sent you, thank you so much. Thank you. Where's Ramesh? I'm going to say thank you to Ramesh, our IT guy. Thank you on behalf of Sony Practices. Thank you for I think I sent you about 50 emails yesterday. Thank you so much.
One more person, Ramesh Reddy. Wherever he is, this guy, anytime we can call upon him. His wife is a Kabi member, but he is everybody's member. Thank you. And now we have the most awaited raffles. Everybody has the raffle ticket. So you are going to win prizes, going to Italy, going to Rome, wherever you want to. Make sure we have the raffles here, tickets here. Okay. Ambika, can you also come here, please? Ambika and Amit. Ambika and Amit. Lunch will be ready right after the raffles. Okay, so the first winner has to be here. 646 485. Okay, last three numbers are 485. Anybody? 485. 485. Anybody? Okay. 485. Okay, we'll take out the next one. People might have gone. Okay, the next is last three. 420. 420 chor. You got it. Come on. No, she's not. She's our favorite. Okay, we'll get the next one. Last three are 435, 435. Okay. Yeah, we will change. It's all 400 going on. We will move down. Anybody 435? You got it? How come? We don't have one. Okay, so he gets it. Sorry. Okay, so give yours. So Dr. Kumar has prepared some raffle baskets. Okay, we are in 300s now. 362. 362. How come everybody is present here? Oh, ये तो घर वाले लोग हैं. Okay, now Ambika, आप decide करें कि आप अपने डैड को क्या देंगे. Thank you for everything. So, this is Ambika's dad. Okay, फिर से 300. 382. 382. Everybody. Oh, 382. I cannot cheat. I'm sorry, I cannot give you mom. 382. Anybody? 382? No. Okay, so somebody has gone home. Sorry. That's up to Dulhar Saab to take our word. Oh, he's very generous. Back to 400. 419. 419. Anybody in town? No? No? Okay, no worries. We have many more. 486. 486. Anybody? No 486? No problem. 492. 492. These are people who just came. 492. People serving there? 492. Oh, okay. So 486. 486 can come here and we will tell his story. First of all, you introduce yourself.
I'm Ghulam Malak. I don't have my glasses on, so I can see the numbers.
So Mr. Ghulam Malik is here. So Mr. Ghulam Malik is here. So ये मुझसे पूछ रहे थे, आप ये टिकट्स दे क्यों नहीं रहे और दे रहे हो तो क्यों दे रहे हो? I said ये फ्री में है इसलिए मजे से मिल रही हैं.
That's right. वो दे नहीं रही थी तो मैंने जबरदस्ती लिया उनसे. Gave me the lucky ticket.
आज इनका अच्छा दिन है तो we can हमारे पास. That is the last one. That's the last one.
Do you want a weight loss consultation? I've got weight loss consultation, or I've got $400 worth of products.
You can easily forfeit. Say I don't want any. Okay. I also have to thank Naveen. Naveen is our professional photographer here today. This is a complimentary job he's doing for us. Thank you, Naveen. He will have his cards. So please, we would love to support our own community. Okay, we are very close to going home and taking the Ninja. 367. 367. 367? Nobody? Okay, no worries. Next. Okay, 448. 448. 448. Anybody? Nobody 448? कोई बात नहीं. Next year. Because आपने निकाल दिया. 365. Woo! Nikita! No way! No way! Okay, Anushka got it.
So this is a weight loss consultation with a friend of mine. She doesn't need it. She can gift it to whoever. I don't care.
You're free to give it to the easy members. We might need it.
Easy member, that's fine. We don't need it. Okay, so home run. Now, आंखें खोल लो, कान खोल लो, और number सुनो. Because Ninja is coming. Okay, yeah. Number 3.
number?
414. 414. No 414? 414? Okay, आप इधर आइए. चलो हमें निंजा मिल. आप अपना नाम. स्नेहल करिया की मम्मी. Okay, so स्नेहल बहन को हमें निंजा मिल रहा है. कल आप सब इनके घर आएंगे. ये कल हमें बहुत अच्छा कुछ खिलाएंगे. मुझे पता. Okay, कल आप सबको इनकी तरफ से invitation. Thank you so much everybody for supporting us, and please enjoy lunch. Thank you. If I forgot to thank anyone, my bad, but thank you Everybody.